Welcome back to the EAU Podcast series Voices of Tomorrow's Urologists, journeying through Europe's resident perspectives. In this episode, we are joined by Chechilia Maria Cracco, urologist in Department of Urology, Cotolengo Hospital in Torino, Italy, and Luis Enrique Ortega Polledo, urologist in Hospital Clínico Universitario San Carlos in Madrid, Spain. Together, they will discuss residents' role in endourology. Join us as we embark on this informative journey.
Hello, everybody. My name is Chechilia Maria Cracco, and I am urologist at the Cotolengo Hospital of Torino.
Hello, everybody. I'm Luis Enrique Ortega Polledo. I'm a young urologist from Madrid. We're here to discuss a little bit with an expert, of course, about the resident's perspective exposed in Europe. So welcome. What an honor to have you here, Cecilia.
So welcome, everybody. Luis and I prepared some questions to cover a variety of topics on endourology. So we will start, Luis, from the definition of endourology for everybody.
Well, endourology, as most of us know, is a subspecialty of urology that will take care of a different variety of pathologies, which are usually treated inside the urinary tract. Not only because percutaneous urolectomy, which is some kind of surgical approach, is performed percutaneously, of course, but mostly we treat these patients or in this specialty through the urinary tract. But everybody associates or usually associate this subspecialty with stone disease. I would like to say that this is more than just stone disease because we have a lot of different pathologies there. For instance, treatment of endoscopic enucleation of the prostate with different energies like HOLEP or FUFLEP. We have UTUC, which is just a part of the oncology that we will take care in this subspecialty. Of course, we have some oncology pathologies like bladder tumors, which are usually treated by endoscopic treatment. So messages or what we were thinking about in the urology is that this is a very, very wide subspecialty of urology. We have to keep in mind that it is more than stones.
So let's say that endourology might be something like most of the times natural orifice and urology, let's say, treatment of all these pathologies passing through an intact urinary tract apart from PCNL.
Exactly. Yes. I would like to ask you, Cecilia, why? Why should a urologist get trained in endourology? What do you think about it?
I think the first reason is that we treat very prevalent and frequent pathologies, as you were saying. Stones, BPH, bladder cancer are very frequent, and any urologist will be dealing with these pathologies during his working life every day, let's say. So this is the main reason. Then I would like to underline that we have two different ages, Luis. So I'm 60, you are 34, if I remember well. And I would like to say that when I was resident many, many years ago, we didn't have so much need for training in endourology because our senior urologists were learning themselves these new techniques. And there were very few, and the instrumentation was very basic, and the technologies were not so complicated like now. So we just had to know that we had monopolar TURP, of course, to know the instruments, but the setting were not in discussion. And we had TURB, and probably that was all because ureteroscopy was not so diffused. And flexible ureteroscopy was something practiced in very few centers. So for me, it was very easy at the beginning to get trained in endourology. I believe that nowadays, for you, young people, young urologists, the question is a bit more complicated because you have a very wide range of technologies, instrumentation, energies to deal with. And so probably you really need an important training in endourology for this reason, because it's not so easy to deal with all these pathologies and all this armamentarium in the correct way.
I completely agree with you. Yes, we've experienced, I would say, two different worlds, probably because it was a huge generational gap between the two of us. So the thing is, right now we have a lot of armamentarium, we have a lot of technologies, video cameras, lasers, we have everything we want right now. it's just a little bit more complex to learn it, of course, but it is a little bit easier to get access to them, because in most of the European training hospitals in our country, we have this access to these technologies. So it's a little bit easier even for you to teach us, which are a little bit younger, with this accessibility.
Yes, this is what I wanted to say. When we started, we didn't have video systems. It was a one-man show, and only the urologist performing endourology was seeing what he was doing. Sometimes there was the possibility to have the teaching double vision, but was very heavy and was mounted on the endoscope. And I remember it was really complicated and very difficult. And then we were washing ourselves completely with irrigation and so on. So it was completely different without the video systems that you have today. So I remember that very well. And I could say that also we were trained as senior urologists. We had to get training when we were older, exactly as you did as young residents and young fellows, of course. But I have a question for you. How and where do we get trained in endourology as residents?
It is really important not to forget that you start getting trained not only by performing the surgeries, but of course studying. To learn the indication of your patient is to learn pathology, the anatomy. You have to learn everything by the book, of course. We have a lot of resources, online resources. The EAU has a lot of resources online. Videos, you have even the guidelines. So you have an access that maybe a couple of years ago it was not so easy, because you may have just the Campbell to study a little bit.
Exactly.
Right now we have a lot of resources, but the first step should be that to understand the pathology and to study, to learn. You're not a doctor because you just decided to go to the hospital and become a doctor. You have to study first. And after that, we have a lot of different courses. How? With courses. Which kind of courses? We have wet labs, we have dry labs, of course. We have this hands-on training that you can find even in your own countries or even through the EAU. So you can get your hands in these different models. Before you start performing some surgeries with your patient, you will have a validated model, or maybe some models that are in the process of validating, to get the feeling, to get the touch, to learn the movement of the surgery before you get started. And where? That's another question, another really important question. I can say by myself that I got trained abroad. So in my hospital, of course, we did some endourology, but I decided to go to a reference center. I went to Italy. We got used in Milano. And of course, there are a lot of centers, even in Barcelona, you have in Germany, you have in the UK, in France, whatever you want, throughout the whole continent. The thing is, you have to be willing to go abroad and to have an open mind, to understand that you can learn a lot of things from different people, not only in your teaching hospital. Be brave, go abroad if you want, and just ask, because there are a lot of people willing to teach you, and they'll be delighted to guide you through this journey.
But really, you said something really important, Luis. You said it's important to study before doing things with your hands and performing surgeries, because if you don't study, it's not just a question of moving your hands and be able to perform endourology. You have to be very humble, study everything, study your instruments, knowing all the details like the diameter of a working channel of a ureteroscope, how the fiber of the laser works, how the laser you're using is functioning, all the settings, always with the goal to be safe and effective for the patient, because the final goal is that one. And so I think that the journey is very long, from studying,
yes, it is,
to performing really beautiful surgeries, in the sense safe and effective surgeries, and being really an expert in your field. Probably you cannot be an expert at the same time of all the pathologies and all the surgeries. I suppose you start from one thing that you like, or that is required in your hospital, and then you go on and develop your own curriculum to become a good endourologist, if you like, this field of urology, right?
Yes, I completely agree with that. Yeah. So, Chechilia, I would like to ask you, how can the European residents organize themselves with the European curriculum? What do you think?
Of course, every resident has to know what they have in their own countries, which are the reference centers and where they can go to have courses and so on, of course, after studying, as we were saying. In every country, I believe, there are training centers for endourology. You know that we can have artificial models, of course, dry lab, wet lab, as you mentioned, animal models, which are not very accepted by everybody, and they are rare and very expensive. Cadaver labs, which have been used very much, but again, they are very expensive. They resemble very much to the real patient, and somehow there are the frozen cadaver labs in Turkey, for instance, in Izmir, we were there, or the Thielen cadavers by Professor Thomas Tailly in Ghent, very good courses. And of course, we have EAU with all the videos, the lessons online, let's say, the European School of Urology, and EUREP, where we have a very valid hands-on training school with the possibility to obtain EST 1 and 2 certification for ureteroscopy. And there are models for a lot of endourologic procedures, which I think are to be experienced. So this is very important. You have to know all the possibilities you have, because now residents are very lucky. They have a lot of things that they can do, but they have to know what they have and choose what they can do and try to get the best from all the chances they have.
For sure, yeah, I completely agree. I think it's a nice insight of what they have in the menu, if you want to say so.
Yes. Luis, I have a further question. So we mentioned all the possibilities to do courses and to do some training and so on, but how can residents in Europe overcome their insecurities when performing endourology? I'm asking you that because you, with all of us, wrote a very nice paper on Minerva Urology and Nephrology on the resident's perspective in endourology, and somehow it came out from your results that they are not very confident with some endourologic procedures, especially percutaneous surgery and the endoscopic enucleation of the prostate.
That's true. Well, what we think in this moment is that these insecurities might be biased, of course, because if you see, for instance, what we thought about this is that if you see ureteroscopy, which is really, really common procedure in most of the endourological units in Europe, you're going to think that it's a little bit easier to perform this surgery, even though it has a lot of technical details that you might omit. You maybe do not understand it perfectly. So you might think that you can do it really easy when you perform the first one or the second one. The same thing happens with TURBT or another most common, or I would say older endourological procedures. But when we talk about the PCNL or the endoscopic enucleation of the prostate, some of the residents might have not been completely exposed to these techniques. So they might think in the very beginning that they are extremely hard to perform, first of all. This might bias their perception of the surgery. But of course, how can you become more secure in your technique? If you see with an open mind and you go to the congresses, this is a nice way to see what others are performing and how you can establish some routine in your technique in order to get, as I said before, more confident and with a nice training. And of course, if you get a chance to visit another center, there are a lot of different programs inside the EAU regarding scholarships to visit another centers to get properly trained. And as I said, open your mind and be willing to learn from others. And I think that's the best way in this moment how we can get more confident in our technique as a resident.
Yes. If I can add something, I would like to add that endourology seems easy, but it's not. It's a question of details, let's say. And this is very important to know and to remember, both from the side of the residents and the patients, which think that mini-invasiveness means easy thing. And this is not absolutely true. The other thing is that now endourology is made up by details. Details are fundamental. When you see the procedure performed by someone who has expertise, you think, oh, how it looks easy, a ureteroscopy, a retrograde intrarenal surgery, or even an endoscopic enucleation of the prostate. But then you realize, step after step, that every detail should run smoothly to have a good outcome. So details include all the knowledge that you mentioned, and I would add also a good pre-operative study of the patient and a good post-operative management of the clinical situation that we have after surgery. We have a before and we have an after, not only the surgery to show that we are clever in endourology. And this is, I think, very, very important.
Yes, that's fundamental. Chechilia, I would like to ask you, now that we just talked about what do we have, how can we improve endourology training in the future in Europe? What do you think it's missing?
I think that training curricula should be standardized, dividing by pathologies, and within each pathology by different surgeries, let's say. So, for instance, if we are talking of urolithiasis, the first training is already available and is like EST 1 and 2 certifications. But afterwards, we also have, for instance, retrograde intrarenal surgery for upper tract urothelial cancer, or we have percutaneous surgery, which is considered very difficult by most urologists, and because it's not performed in every center, and you should be also a high volume center to become an expert percutaneous surgeon. So I think that each of the surgeries within each pathology should have a standardized training. And this requires a big effort. For instance, endoscopic enucleation of the prostate. Now we have the training models from the companies in Europe as well for all the mini-invasive surgeries and also endoscopic enucleation. But for instance, virtual reality models are on their way. My director, Dr. Scofone, worked at virtual reality Oculus during the COVID period to help people learning somehow to enucleate endoscopically the prostate, the adenoma. And it has been also published. And I know that many people is working in this direction, because the important thing would be to have also easy models, not very expensive, and easy to reach at any time of the day. For instance, it might happen that a resident works the whole day in the hospital, and in the evening he's tired and sleeps, but otherwise he can practice puncturing on a model of kidney to become able and clever to do the percutaneous puncture. So if it's easy to reach, he or she could do this whenever he or she likes, during the weekend, during the holidays. Also, this could be a good chance to become more clever, to move your hands, let's say, before moving them really on the patient.
I think the same way. I think the models are missing, especially in those techniques, probably the most difficult to learn according to most urologists. And I think we have to make an effort to overcome this difficulty, because of course we don't have in every single center a lot of volume, especially for PCNL, but we should get trained, I think, in a better way in these techniques in order to be safer for the patient and more effective, which is the main goal, probably, not to become a great surgeon, but to become a great surgeon for your patient.
Yes, and I think you always need to be very humble. We always say when you are the OR and performing ECIRS, that we perform ECIRS instead of TNL, we always say it's always like the first time. You have to be very attentive, very delicate, very careful to all the details, because otherwise something might happen. And that endourology is perceived as an easy approach by the patients. And in Italy, for instance, is one of the most frequent causes of medical legal problems for the urologists. And we also have to consider this. So training is important also to be in line with guidelines and to have an adequate preparation and to be ready to afford real life in the OR, let's say.
Well, Chechilia, thank you very much for your collaboration, for your moderation today. It was a pleasure to talk with you about this great field, which is the endourology, that we are passionate to, and I would hope to see you soon.
I thank you, Luis, and I hope that all the young urologists are like you, so passionate and so happy to do their work every day in their hospital and to deal with the patients. Thank you very much.
Thank you very much.
Thank you for this insightful episode. We are sure our listeners enjoyed it. To keep up with the latest EAU podcasts and stay informed on urological advancements, be sure to subscribe to our EAU podcast channel on your favorite podcast app. Until next time, keep learning and stay inspired.